kidney transplant nephrologist professor and researcher in Guadalajara, Mexico. I'm a member of the World Congress of Nephrology social media team, and I'm delighted to host today WCN'24 Pre-congress interview with Dr. Sara Davison. Dr. Davison is a professor, bioethicist, and health outcome researcher in the Faculty of Medicine and Dentistry at the University of Alberta, Edmonton, Canada. She's a nephrologist with Alberta Kidney Care. She's a recognized internationally as a leader in kidney supportive care with over 174 publications and is the director of the Kidney Supportive Care Research Group. She's also the chair of the ISN Kidney Supportive Care and Conservative Kidney Management Working Group. Her research program focuses on the many aspects of quality supportive palliative care with advanced kidney disease. A warm welcome, Dr. Davison. It's a privilege to have you here.
Thank you. I am absolutely delighted to be here. Thanks for having me.
Okay, as we eagerly approach the World Congress of Nephrology, we are excited to travel and dive through the nephrology latest news. And for me, it's the first time in Argentina. Dr. Sara, are you excited as well for this event?
Oh, yes, I'm absolutely excited. And it's going to be the first time for me in Argentina as well. And the World Congress, it's always such a great opportunity just to, reconnect with colleagues and old friends. And I always come back from these meetings just, I don't know, with a renewed enthusiasm and excitement, and always something, new knowledge, some new ideas. So yeah, I'm super looking forward to it.
Okay, you will share and also you will speak at the Conservative Kidney Management course designed for nephrologists and associated healthcare providers. The course examines the challenges through conservative kidney management, including issues of resources, capacity building, and advocacy in low and middle income countries. Can you give us like a glimpse of what's expected in the course?
Sure, I'd love to. So this is a first. We're just showcasing this new course for the first time, and we have a wonderful international faculty from across varied healthcare settings to do it. So the day is going to be broken down into 3 two-hour sessions. And the first is really going to be looking at the fundamentals of kidney supportive care and conservative kidney management. So we all understand what we're talking about, what the core components are, and how the philosophy of care really changes and shapes how we care for our patients. And in this first session, we're going to be explicitly exploring how, for example, you're going to change the management of the common complications of CKD. We're going to talk about how to have some of those difficult conversations about choosing conservative kidney management. And we're also going to integrate a round table around a case discussion so we can try and tie all those issues together to really highlight some of those key points and talk about some of the, the practical challenges that clinicians and people with kidney failure may face when, discussing and delivering this care. Then the second session is going to be focused on symptom management, and we're really going to focus on the practicality. So it's going to be very practical advice. So we'll be looking at restless leg, itch, pain, insomnia, fatigue, anxiety, and depression. And then that third session, this is where we're going to explore program development. So this is where we'll tie up the day. We're looking at program development, capacity building. So what are those challenges and implementation strategies that might be beneficial for starting or expanding a kidney supportive care or CKM program? And how can you integrate these elements of care into your kidney program? So this last session will also include tips around communication skills, and we'll also tie in the care of the dying patient, so that terminal care in the last few days of life will be addressed here as well. And then throughout all of this, we're going to have a particularly sensitive approach to unique considerations across low and middle income countries. And we're really hoping to generate a lot of discussion, because we want to learn from our participants as well about their unique challenges. And in doing so, we're hoping that we'll be able to improve, so adapt our curriculum, and then generate additional ISN resources to really help implement this care across the globe.
Oh, great. That will be awesome to share and to communicate different experiences, no? Because it's not the same probably in North America, in South America, and Central America. So it's going to be really excited. I also review your publications and you have like the use of cannabinoids on kidney disease. So I'm really excited. If probably you can give us like a glimpse about how was the effect of using and control pain management probably in advanced kidney programs.
Yeah, we will be touching on pain, both the pharmacologic intervention, and we've got a great speaker about non-pharmacologic interventions for pain management as well, especially for areas that just don't have resources to good medications. So yeah, there'll be some of that as well.
Okay. So entering more about it, what recommendations would you give to the involved healthcare staff to integrate kidney supportive care? Obviously, the realities are really different from America, from Africa, from Europe, from Asia. Okay, so ESN has like that diversity of nephrologists and that diversity of situations, but how can we involve into the conservative management of kidney disease?
Yeah, it's a really tough question. And I think you pointed out really well that we have differing resources, different cultural contexts. So it really depends on where you're starting and what resources you have available to you. But in principle, starting something is better than having nothing. So I typically say start small. And if you're going to start small, just make sure you do it well. And as long as it's seen as the first step and not the final destination, you're going to do great because those small successes generally beget larger and larger successes. So specifically though, if you're going to start small and you're trying to pick that first step, I suggest that you really focus on what is that one thing that matters most to your stakeholders. So your patients, your care providers, I mean, there's many things that need to be done, but what's that one thing that everyone can buy into and share and get excited about? And perhaps picking that low-hanging fruit so you actually can do it. And it might be symptom screening. It might be focusing even on only one or two key symptoms that you know that you've got the resources for and you feel that you can do a good job about. It might be about just really teaching them about shared decision making and having the conversations around conservative kidney management so you can do that well and get people on a pathway. If it is around CKM, maybe it's about just focusing on those metabolic complications and how you change that philosophy of care, because that's relatively simple to do and doesn't take a lot of resources. It may be something as simple as running a workshop on communication skills so you can start engaging patients in the priorities. But I think whatever it is, having all of your patients and care providers really share in that common vision and buying into the importance and value is really crucial to the success, especially as you're just getting out of the gate.
Well, and probably embracing the kidney disease is not only having patients under hemodialysis, dialysis, or kidney transplant, but also offering other treatments that are more sensitive stuff that probably we are not so used to into our daily practice. So it's going to be really interesting.
Yeah, I agree 100% that kidney supportive care and conservative kidney management are key core components in integrated kidney care, and we have to be able to do them well. And that's what we're hoping to be able to start building capacity for with this course.
And what measures can we take to provide kidney supportive care on dialysis patients? Because we have some patients that are really frail with multiple comorbidities, and probably dialysis is not like the best stuff that we are offering until now. And probably that situation of individualizing therapy, but including other therapies that are equally as important to create a better quality of life in our patients.
Absolutely. You said that actually so beautifully. There are so many measures that, we should be taking, but the key that you said there, which was so important, is that we need to focus on the individual patient's priorities. And if we start there, the chances are we're going to be successful. So the first thing, it really starts with talking to that individual to understand what matters most to them. What are the most important aspects of care? What are their greatest concerns? And then we prioritize these issues. And for most of these patients, especially, they're frail, as you said, they've got multiple comorbidities, it's usually around maximizing their quality of life. And if we're talking about maximizing quality of life, that typically means symptom management for most. So it means, we need to be screening their symptoms. We need to be asking them how they feel. And then for the symptoms that are really compromising their function, their cognition, or just how they're feeling, these symptoms need to be addressed. But it's more than that. It's, as you said, they are frail, have lots of comorbidities, and, their survival may not be for very long. We may be talking months, a year or so. But when we have this more palliative approach to care, it really does shift, even though they're on dialysis, it shifts how we manage those common complications of chronic kidney disease. So we shouldn't be chasing biochemical parameters the same way or normalizing values. So to give you some examples, if we're talking about calcium and phosphate balance, instead of normalizing the blood levels to prevent bone abnormalities and vascular calcification, our attention, should really shift to promoting their quality of life and nutrition through liberalizing their diet. And we need to keep in mind that these patients are already at risk for protein malnutrition. So, we would only phosphate restrict if we thought the hyperphosphatemia was contributing to symptoms such as restless legs or myalgias, arthralgias, what have you. Similarly, they're unlikely to get benefit from statins in the last year or so of life, so maybe we should consider stopping them. Things like blood pressure control, should be aimed at optimizing physical and cognitive function and minimizing the risk of falls rather than long-term survival. So for some, this may mean more liberal targets. And, when we talk about nephrologists, we're always cutting back on salt, salt restriction. I'm a huge believer in salt restriction. But for some patients, perhaps we should be liberalizing if we've got a palliative approach to care, if it promotes palatability and quality of life, even if the blood pressure inches up that little bit, as long as it doesn't result in shortness of breath and peripheral edema. So all these aspects of care require careful individualization with each patient. And then, of course, it's all those conversations around advanced care planning and talking and planning for the end of life and what that might look like, and addressing any fears or concerns our patients have. So so there's many things to do, but these are just some of the considerations. And as you said, it's individualization that is truly key.
For me, it was a real pleasure to be here on this pre-congress glimpse. So everyone, please save the date for Saturday, April 13 from 9 a.m. to 4:50 p.m. local time, and join Sara at the Conservative Kidney Management course in Buenos Aires, Argentina.
Thank you so much. I'm absolutely so excited about this course, and I'm really looking forward to the day and to seeing you in person as well. Take care.